can you see the screen?
Yes.
Yeah. Today, the first series of the webinars related to social accountability. And last year, we start talking about the concept generally. This year, we'll start with operationalize this concept and to see how we can move forward with the concept of social accountability at educational level, community service level, and research level. The outline of the discussion today will be around uh, understanding social accountability concepts and milestone in medical education, defining role of medical school and health sciences school in society, and then integrating the social accountability into day-to-day practice and discussing the challenge that we may arise when thinking about this integration. And this presentation basically based on the AMI guide that has been published this month, titled Instilling Social Accountability into Health Professional Education with International Case Studies. So most of the slides that I have prepared today were basically from the work that we have been working on since the last, for more than 1 year. Let's start our discussion by defining the social accountability. So what do we mean by social accountability? In 1995, the WHO defined social accountability as the obligation of medical and health science schools to direct their education, research, and community service activities toward addressing the priority health concerns of the community, region, and nation they have the mandate to serve. So based on these definitions, we have different levels of medical and health science schools. Some of the medical and health science schools, they are neutral with no interaction with the community. Some of the medical and health science schools, they are reactive and they are taking reactive roles when dealing with the health community issues, while some of the medical and health science schools, they are proactive and they are proactively engaged with the community issues and support the community. And their role is not only to educating the healthcare professionals, but to have a great impact on the community health at the region that they serve and at the country level. And based on this definition, the medical schools has been classified into different levels: social responsible, social responsive, and social accountable. And the social accountable actually is the higher level that is related to the work that can be done toward the community. And translating accountability in Arabic is about al-muhasabiyya compared to responsibility al-mas'uliyya. That means the medical and health sciences school, they have accountable role and they are accounted to the community that they serve. And when it comes to the directions of education, research, and service toward addressing the priority health concern of the community, region, and nation, identifying of these needs, actually, it is not only the role of the medical and health sciences school, it is the role of the medical and health sciences school along with their stakeholder, such as the healthcare personnel, the community, the health systems, the graduates, and the legislations bodies, such as the accrediting bodies and the health service providers body. And when it comes to studying the literature about what makes medical schools socially accountable apart from curriculum or at a large level, this has been reported by many studies, including a study that has been conducted in the region here in Emru region. And among the studies that conducted worldwide, it has been found that curriculum structure has affected the medical and health science schools directly to be social accountable. And it has been found that those medical schools who have applied the or adopted the community-oriented and community-based curriculum, they are ready to be social accountable compared to those medical schools that they did not have any interaction with the community that they serve. Being social accountable, medical schools and integrating the concept of social accountability and principles and values into the curriculum will not benefit only the medical school. This benefit is extended to the patient, to the students, and to the medical and health science school. And it has been found that for medical school that adopted the social accountability principles and values, they, they graduate healthcare providers who are trained with these principles, and this has been proven to provide more patient-centered care, because if we look at the principles and values of the social accountability, uh, patient cares will be closely integrated in the four values that we will, inshallah, discuss during these sessions. And also, they consider socioeconomic and cultural factors affecting the patient outcomes, because, again, these values are closely integrated with their education, and therefore this will reflect on the patient outcomes. And also, it will support the community to reduce health disparities among underserved populations. Particularly, the case will be very, very obvious in developing countries, and in the countries that they don't have the good services and facilities. Also, this will help to have a good understanding of patient lives, lead to more effective management plan. And because uh, those graduates with the social accountable curriculum, they are aware with the social determinant of health. And it has been, the studies and the literature has been proven that not less than 35% of the problems that take the medical problems are not directly the disease origin or so on. They are from the other social determinant of health, including the socioeconomic status, the educations, employability, and the other factors. So those graduates from the social accountable curriculum, they have the holistic approach to effectively manage the patients. And also, it leads to increased community value and trust of the graduates, because we are, as educators, we have a certain views for our graduates, while the community expectation sometimes is different from the educators' expectations toward the graduate, because the community is not only expecting our graduates to have their excellent clinical skills, they also expect graduates with other important skills, such as being passion and compassion and good communicators with good leadership and so on. And all these are well addressed when it comes to talk about socially accountable curriculum. Also, it has shown that participation in the community health programs foster healthier and more resilient populations and health system. And this is very obvious in the medical schools that adopted the social accountability. So again, the benefit will not be at the colleague level, the benefit will be at patient level, students level, and the medical schools and health sciences school level. Let us see for students the benefit of incorporating social accountability into the curriculum. It has found that social accountability encourages students to view healthcare issues from a broader community and societal perspective, rather than focusing only and being oriented only to disease. Also, It helps them to understand and be able to promote a comprehensive approach to care, and most importantly, enhance the cultural competencies and how to deal with different people from different background, and fostering the aspects that related to equity, diversity, and inclusion. And also for the students, uh, studying in a curriculum, social accountable curriculum, help them to uh, provide practical experience through the community health programs, improving understanding of community health needs, and emphasizing ethical practice, patient advocacy, and addressing health inequalities. Community immersions help students also for better understanding and collaborative with diverse populations, and finally contribute to community well-being, enhance professional satisfaction and sense of the purpose. This is for the students. And finally, at the college level, it helped the college level to gain trust from the community and to be perceived positively. Therefore, the college will be perceived positively by the students, faculty, and the public. And focusing on social accountability at the college level will help the college to open for research opportunity and funding, particularly for the researches that related to the industry and the community. And these graduates support the students' education during the community placement and provide patient-centered improving outcomes. And, uh, and for the medical schools also, particularly in the developing countries, it can support the rural area, because the study also proven that students who came from the rural area and study in the medical school, they have their tendency to go back and to serve this underserved area. And most importantly, the social accountable driving curriculum, it helped to inspire the health system stakeholders to adopt similar space, and this will lead to bringing or breaking the gaps between the medical schools and the health systems. Considering this also broad scope of the social determinant of health, uh, this has been discussed in these guides, and with the focus more on the social accountability. Another important question is, what are the expectations of the doctors and what are the expectations of of our graduates? Because understanding the expectations from our graduates will help us to think critically to what extent integrating the social accountability in the curriculum is needed. The expectations of the graduates are defined by the community, by the professions, and by the health systems. And nowadays, there is a changing roles of all graduates from all colleagues because of the dynamic of the health system and because of the evolving role in the health system. So nowadays, graduates are expected to practice their role in a multidisciplinary way in a team-based care. There is advancement in the artificial intelligence and technology. There is also expected to have their role in the enhancing the quality of the health services and accountability. There is expectation from the graduates to have a certain competence related to the information management and dealing with the huge amount of informations, which is called infodemics as terminology recently introduced by the WHO. The patients now became very educated, so and a certain type of communication is expected from the graduates, and also the graduates are expected to take a leadership role, so that need to be trained in a leadership role that they can lead a lot of things in their health care system. So All these things necessitate the need of having a curricula with the way that to prepare their graduates to serve the community in a good way. So this will let us to move to the what are the values that we need to take care about related to the social accountability into our curriculum. So we have basically four values that need to be addressed and need to be considered when it comes to talk about the social accountability in the curriculum. And these four values are the relevancy, the quality, the equity, and the cost effectiveness. When we talk about the relevancy, this is related to the relevancy of the curricula toward the community, which is defined by the role. And when it comes to the relevancy within the context of the health system, this is related to the relevancy of the health service delivery based on the community need. When it comes to the quality as a value related to the social accountability, it is related to, in education domain, it is related to collaboration to address the social determinant of health. Therefore, this social determinant of health need to be clearly and explicitly integrated, not only in the community health programs in the colleges, it should be integrated from day one till the graduation of the colleagues, because this is the responsibility of all colleagues at different phases of the curriculum. When it comes to the community, this is related to minority recruitment and placing graduates in health professional shortage area, and cost effectiveness. This is related to promoting primary health care models, so that promoting advocacy for health and promoting preventions, so that to overcome the cost issues and the burden of the spending money on the health. Now let us talk at at curriculum, and as a curriculum planners, we need to think at different level from core, then here, and then to the end. We need to think about the graduate competencies. And these graduate competencies are usually based on the national needs. What does the country need? Which type of the competencies that are needed by our graduates? Nowadays, we have several competency framework for medicine, for dental, and for nursing, and for pharmacy. And all these frameworks, fortunately, has been approved by the CAA and recommended to be integrated in all curriculum. And fortunately, all these competencies are fostering to reform the curricula, so that to have social accountable graduate and community sensitive graduates. So it's very important to revisit the graduate competencies in the curriculum. Following revising the graduate competency, then we come and see the curriculum content in terms of the topics that are taught and the teaching and learning methods that are used in this curriculum, and to what extent the curriculum is delivered at the community level, not only inside the classroom. And the macro level, it is related to the impact of health. This is a macro level. We need to evaluate to what extent does our curriculum, and therefore our medical school, our health school, has an impact at community level. And this impact can be measured by clear metrics and clear key performance indicators related to research, education, and community service. How do we prioritize our research? Do we conduct research based on the colleagues' need, or we are conducting research based on the community need and in collaboration with the community? To what extent the education that we provide supporting the community, and to what extent we are providing service to the community, not only related to the clinical service professions, but also related to health promotion, health advocacy, and educating the community. This is very important thing that we need to carefully reflect on the current practice of the curriculum and to see at micro level, meso level, and macro level how do we interact with the community and to what extent we are integrating the four values of the social accountability, which are relevance, quality, equity, and cost effectiveness in our curriculum. And we developed recently this framework, which is extracted from KERN, 6 step for integrating social accountability into the curriculum. And if you can see here, these are the 6 steps by KERN that is starting from problem identifications, general need assessment, then targeting need assessment, then developing the goal and objective of the curriculum, then revisiting the educational strategies, then implementation, and finally, evaluation and feedback. So we need to effectively collaborate with the stakeholders, and we need to revisit the curriculum and identify the priority health problems that is related to the community. And following identifying this priority health concern, which is related to problem identifications, we need to have target need assessment, which is closely related to the graduate competencies. And after identification of the priority health problems, we can refine the graduate competencies at different levels, matching these competencies with the competency framework. Accordingly, after doing these 2 steps, then we need to think about the educational goals, learning outcomes at program levels and at course levels based on the society health needs. And also we need to consider having an effective hidden curriculum that fosters social accountability. Then in between, we need to revisit the curriculum development process and instructional planning, which will be the next slides, that related to how these goals, learning outcomes, being delivered to make sure that these competencies will be transited to the graduates. Then after that, we should look at the educational strategies using the appropriate teaching and learning methods that consider these health issues. And then we need to go to implementation. When we go to the implementation, very important to consider the authentic learning approach. And authenticity comes from bringing reality into education and to keep the education system very close to the to medical practice. We need to have more weight for community-based education, student-centered, and service learning, which is related to educating the students while providing the service. And at the end, we need to have a framework for evaluating our educational program toward the achievement of these social accountability goals. Here are appropriate teaching and learning methods that has been identified also by best practices that can foster the social accountability in medical schools. Integration of social accountability in problem-based learning. Problem-based learning could be considered as good vehicle and good platform through the PBL case scenarios in integrating and instilling the social accountability principles and values. This could be for pre-clerkship level. For the clerkship levels and for the clinical phases, case-based learning, considering issues from the health system and from the community within this health could be considered. In several medical schools, particularly in Canada and US, they are using longitudinal integrated clerkships where all clerkships, medicine, surgery, pediatrics, obstetrics, family medicine, emergency medicine, and specialized programs are integrated together with the rural medicines program. service learning and community engagement. Community-based education also by placing the community students in the community, and also through interprofessional educations by bringing more than two professions where they can learn, collaborate, and communicate with each other. This car has been developed by Professor Bashir Hamad Early and Prof. Magzoub. It was related to the community-based education and how it can help in serving the community. And when they develop this car, they believe that community-based learning could be considered as the engine of this car with the driver of community-based educations. And in order to move forward, and the driving force for this car should be social accountability, so that having social accountability as ultimate goals could drive this car to move forward toward serving the community. And we need to move forward actually from community-based education to service learning. And service learning, actually, it is related to providing education while serving the community. And the figure that in front of ourselves is the service learning cycle. And this service learning cycle is a structured framework guiding individuals or group in medical schools through a comprehensive process of community engagement and learning. And this cycles has main 4 areas, including the investigation, preparing and designing, taking action, and reflecting and communications. And for investigation, the aim is to identify and understanding the community needs and issues. So we send students, and students at the same time, they are providing service, investigating issues in the community while providing service, conducting research, surveys, and interview. And the best example for that is the program provided by some of the universities in the region, interdisciplinary field research and training. And the outcome by this investigation is to develop a clear understanding of specific needs that the service project will address. Then, as a result of service learning, designing, and preparations, and this is related to planning and organizing the service activity. And this will take place after effective partnership with the stakeholders, determining the success criteria, developing the action plan, and allocating the resource accordingly. The third step is related to the taking action, and this is related to executing the service project while effectively collaborating with each others. During this phase, students will demonstrate intercultural understanding through the action that they are taking while they're learning, and they perceive through the action and demonstrate community toward the community. And the ultimate goals here is to address the identified health needs through the meaningful and impactful activities. Finally, when it comes to reflecting and communicating, it is related to analyzing and evaluating the service experience while they're studying the service. And this will take place through after engaging in discussion, journaling, and presentation to assess the impact of the service while considering the personal growth and health outcomes. And here, students can gain insight into the effectiveness of service, personal development, and area of development. So this structure framework can help the students to learn very well while providing the service. Now we'll see the examples of integrating social accountability across the curriculum. And this inventory has been developed in 2021 with some of the colleagues from the College of Medicine. And This inventory was based on the WHO social accountability inventory, and this inventory has been um, used, evaluated, and validated in the College of Medicine in this study, and also with our colleague Mohamed Hassan in Ireland in the College of Medicine in the Limerick, and also with the group of researchers in Suez Canal in Egypt. So the inventory used the 4 values of social accountability and assess this social account, how the curriculum address these values. A very important component in moving forward with social accountability is a faculty development, and we are in the process of developing a course, how to move with the how to apply social accountability in the curriculum and in the teaching and learning and assessment. Most importantly, the social accountability need to be considered in assessment because assessment drive learning. And in this book, there is a chapter about social accountability and assessment that also discuss how assessment need to be reformed to be social accountability. It's very important while moving forward to discuss and explore the social accountability governance in medical schools and health sciences school. And we are fortunate that we have a social accountability committee for the 4 colleagues across the campus, and we look forward through this committee to drive many positive change that we have. Now I will explore some new case studies that successfully implement social accountability. The first case study is from New Mexico, US, and in their School of Medicine, the medical students begin exposure to primary care and rural health challenge in the first year, and they have weekly clinic sessions continue for 3 years within the community, and students spend time with the primary care physicians from 10 to 25% over the curriculum, and they are using service learning, which is integral, including urban Native American reservations and rural communities, and they are using their research to foster academic community partnership for sustainable research and improve local health outcomes. Another example from Canada, from British Columbia, Faculty of Medicine, they have 4-week rural family medicine, family practice clerkship, provide students with diverse clinical experience. And they have 4 clinical sites over 12 months, integrated clerkships, where all clerkships are integrated together, despite challenge from increased class size and postgraduate programs. And they have friendly community campus partnership, include initiatives such as community service learning, self-directed project, and among the students. And the curriculum emphasizes 4 core concepts, which are collaborative care, research, and scholarship, health promotion, and disease prevention. And they have a comprehensive social responsibility and accountability framework with 11 themes addressing the health disparity, diversity and changing demographics, indigenous population and healthcare, global health, training methodology, collaborative care, and patient-centered approach. Another example from Canada, North Ontario School of Medicine. It is recognized for its distributed community engaged models, and they operate across 90 indigenous group, francophone and rural community in North Ontario. And students learn actually from diverse faculty, patient communities and organizations, gaining deep contextual knowledge of social determinant of health. And also they are considering recent innovation, including digital health records, spatial analysis, AI, e-health tools, and data governance to align research with the health system. And they have established the Center of Social Accountability. In Indonesia, the Georgia University, they implemented what is called CBE3 model of curriculum at micro, meso, and macro level. At micro level, they are considering the self-directed learning, team where collaborations and development of socio-humanistic skills. At meso level, involve comprehensive coordination on teacher training and CBE program to ensure the sustainability. And at macro level, with this, with integration, with collaboration with the national postgraduate practice, curriculum demonstrates strong commitment from faculty, leaders, and management. The final examples will be from Philippines, where promote social accountability through its focused community engagement practice. They are using experiential learning and addressing the priority of health concern in the region. They are using community-oriented education, transforming students' attitude toward community service and caring for underserved population. And they are using community-engaged learning program, immerse students in the community for a nearly half of 4-year program, and they actively engage with the stakeholder to promote public health through joint research project. The final thoughts is how to move forward. Because I believe that we have more or less adopting, applying, or we are taking most of this initiative by the 4 colleagues across the campus. And we think that the boss model that to drive this change is the appreciative inquiry, which is also called the 5D model, which composes of defining, discovery, dream, design, and delivery. We need first of all to define and clarify the purpose and scope of integrating social determinant of social accountability in the curriculum. And we need to collaboratively discuss with the stakeholders and to establish a shared vision toward social accountable curriculum. For the discovery, we need to ask ourselves what works well, what the good thing that we are doing, identifying the existing strengths and successful practice related to social accountability, and very important to analyze the current programs and gather feedback from students, faculty, and community partners. And it is highly recommended that research to be conducted from students, from faculty, doing self-assessment, asking for feedback from the stakeholders. Then after that, we need to develop a dream, which is related to vision of the future. And we need to envision the ideal future state of social accountable curriculum. And we need to facilitate workshops to brainstorm innovative approach for embedding and instilling social accountability across the curriculum. After that, we need to plan for change, for design. Then we need to develop actionable strategies to achieve this curriculum through the action plan. And finally, implementing the change for sustainable curriculum change that related to the community. And then we need to monitor the progress. I like this proverb, African proverb: if you want to go quickly, go alone. If you want to go far, go together. So this just was thoughts related to social accountability in medical curriculum.